a lot of the questions still surrounding over what could happen on the COVID-19 front, as we talked about off the top of the show. Some alarming trends there. You'll hear from people that a rise in case counts not necessarily the most alarming, because we have seen testing capacity increase. So that might explain some of the moves in record number of new cases for the fourth day in a row being seen in states like Alaska, Arizona, Arkansas, California, Florida. But beyond that, we also are seeing a spike in hospitalization rates. So not just testing here to be worried about. Arkansas, North Carolina, Texas, and Utah all posting a record number of patients entering the hospital this weekend. So considering how many states have opened up here, even ahead of the White House guidelines, let's remember that. And those were not exactly lofty goals to meet thresholds here in terms of reopening. The question becomes, should we have expected this in the first place? And here to answer that, as well as the shifting policies around reopening, is again Dr. Ezekiel Emanuel, the former Obama White House health policy advisor and vice provost of global initiatives at the University of Pennsylvania. And Dr. Emanuel, appreciate you joining us once again. Now that we are seeing kind of the data shift here and worries about what's happening if we open too quickly, what's your take there on that front? And maybe are you not surprised, considering the fact that a lot of these states reopened ahead of the White House guidelines?
I'm not surprised at all. And as a matter of fact, if you actually look at the states, what you can see clearly is that when they rush to reopen, 4 weeks later, almost to the day, you see this beginning of the exponential increase in the number of cases, and that several weeks later will increase the number of hospitalizations and then deaths. This is not a surprise. These places never really came down, never had 14 days of declining cases and hospitalizations. The justification in the president's own criteria for reopening the economy. Plus, the president suggested that when we reopen the economy, it should be in stages. You don't do it all at once. You do it progressively. The closer you are, the more intimate and prolonged the interaction, the later the opening. Most of these states just rushed in, not heeding the guidelines that the president outlined. And as you say, they weren't even very stringent that many public health people, myself included, suggested. So this is no surprise, absolutely no surprise that you're getting the increase, and no one should be shocked.
Yeah, we're also seeing, I mean, even in states that have had more stringent guidelines, here in New York, we've seen Governor Cuomo warn that they could potentially see a return to lockdowns if these warnings are not heeded. But when we think about what has changed and what hasn't, we're still looking at a lot of experts weighing in saying that we're very far away from herd immunity, still far away from vaccines, so there has been progress on that front. When you think about the case count that we've seen, over 2 million, people are talking about having 70% of the population needing to be infected before you reach herd immunity. So what's your timeline for where we go from here if we are seeing a rise in cases? Is it inevitable that we see a second lockdown? Because the White House has come out firmly against that idea. But even in China, we saw Beijing issue at least a section of the city being locked down again. So what are your thoughts on why that is almost inevitable if the cases continue to rise like we're seeing now?
Well, for the reason you said, cases are going to rise. I think the president and the administration want to now pretend that COVID doesn't exist and minimize its impact. But we're at 115,000 deaths. And before the end of the year, we're almost certainly going to be at 250,000 deaths or more. And that is a huge increase in our death rate in the United States. And I think pretty unacceptable. And, you know, a lockdown is only a temporary measure. It's a temporary measure to get in place a testing regime, a contact tracing regime, and an ability to isolate the few cases that arise. And you can see when you put in all the public health measures, the lockdown, physical distancing, the face mask wearing, the hand hygiene, the closing of businesses, the limiting of crowds, you do get a nice decline. Look at New York, look at Pennsylvania, look at Illinois. And if you slowly ease up in the right way, you can actually keep those numbers down. The issue is to do it in the right way and at the right time. And that's what Florida and Texas and Arizona have not done.
Yeah, and we've seen the consequences of that. But interesting also, the update that we got today when we look at the drug front. Of course, President Trump had touted some maybe reasons to be optimistic. He was touting drugs out there that he believed would be helpful in battling this crisis, mainly hydroxychloroquine, the one that he said he was taking that drug as a preventative measure for COVID-19, despite the fact that we didn't necessarily see a lot of data supporting that decision. But the FDA today revoking the emergency use authorization of that drug for COVID-19, still being used effectively to treat patients with lupus and other effects. But when we look at it, you told us before that this drug would not be a silver bullet. You turned out to be very right on that front. But what is the decision now to revoke its position at the FDA? What does that do to the faith in that department, especially at a time when a lot of Americans are not really on board of the idea of a rushed vaccine? How could it implement or how could it impact Americans maybe facing that decision now?
Well, I think your point is right. The FDA has to be more careful with its emergency use authorizations, its EUAs. It issued this under tremendous political pressure from the president. It has to get spine. Political pressure is not good for making decisions that require science. You need to make them on the basis of science, and that will have to be true when they get a vaccine. A number of us experts out there have said we cannot use emergency use authorization for a vaccine. We need absolute hard scientific evidence that a vaccine doesn't just increase antibodies, but actually protects people from infection and transmission. And that will require a full effectiveness study, not to say, well, the antibodies are up, time to actually release it and give it to people. And so I think the FDA has to take this hydroxychloroquine case as a warning that, rushing under political pressure and economic pressure, science is not a good idea. And they need hard data on which to make decisions about whether drugs and vaccines actually protect the public.
Yeah, let's stick with that point, because even as someone, watching this play out, it does seem worrisome if you do have an agency like that maybe making political decisions rather than the scientific ones you'd expect from the FDA. But on the vaccine front, we've heard from professors, mainly the one tied to the Imperial College London attempts there to make progress on the vaccine front, saying that it's not necessarily showing the case that you're talking about the immunity there that could come from it, but rather trying to stem the problems of the disease, the symptoms of the disease, the health implications of the disease. And that might all be what you get with the vaccine, at least the early candidates here. So what does that do for the timeline in terms of actually having an effective vaccine to battle Texas?
Lost you there. I'm not sure exactly what your question was. But look, a vaccine is good if it prevents transmission and therefore allows people to engage in economic activity without worry that they're going to get sick with a potentially deadly virus. And that's the key. The initial vaccines may not do a 100% job. They may not last that long. But we've got, thankfully, over 125 candidate vaccines. And God willing, the science will give us ones that will work, that will protect us from getting the virus and protect us for a long enough time that they're worthwhile getting. And those are going to be the two key requirements.
Yeah, and hopefully we can get there sooner rather than later. When we think about businesses, not just small ones, but also large ones navigating through this too, maybe projecting getting a vaccine like the one you're describing here in 2020, we've seen a lot of sports leagues starting to come back and instituting plans to relaunch their seasons. The NBA, most notably moving forward with the July 31st return in the bubble in Florida to be held there. You also have, though, the NFL still waiting, maybe the benefit of a little bit more time here. But today, NFL Network reporting that a few players on the Cowboys and the Texans testing positive for coronavirus. So what is your thoughts on this as a doctor watching some of these sports leagues start to think about coming back and the health risks associated with that? Can the NFL actually come back?
So I have given some advice to some of the sports leagues. I do think this idea of a foreshortened season in a bubble makes a lot of sense and is something that can be done. It will require the teams to sacrifice and to preserve that bubble. And I know it is a big sacrifice. But I do think that's important. And I think it's also important that they take that very seriously. It not be a porous bubble, because the moment you have a porous bubble, people coming in and out, players going home, you have them exposed to a number of other people. And, just a few cases are going to make it hard to play. As you say, Dallas Cowboys team shows positive. The NBA quit stopped because some players were positive. I do think a bubble is possible, and it will require, putting a number of people in one spot. But I do think that's the right approach. And I think that's something that does need to happen. I myself am not a big sports fan, but I think getting sports back into the country is really important psychologically for the country to return to normalcy and to have things that they can look forward to. And I do think, the sports leagues need to take seriously this lockdown. I have had conversations with Roger Goodell and some people in the basketball side of the world. So I think there's a way to do it. And I think it is going to be stringent and it is going to be rigorous, but I think it's worth it for everyone, for the teams, for the country.
Yeah, and Dr. Anthony Fauci would seem to agree with you, at least complimenting the NBA's plan to bring things back to normal there in their bubble. A little bit harder for the NFL with more than 50-man rosters, 32 teams, a lot of beefy guys on those rosters as well. So there's some separate health issues on that front. But just want to wrap things with an op-ed that you and your brother recently penned when we think about what can be done from a systematic approach to kind of battling all this. You've raised issues in that op-ed, mainly that the federal government right now through the CARES Act has helped states battle this crisis. We're not necessarily sure what's going to come from the next wave of stimulus in terms of supporting states' budgets and all the costs associated with the coronavirus crisis. But you guys are basically pushing for a lot of those stimulus measures to be put into place permanently. Talk to me about why you think that is needed and why you think that the federal government should now take a stronger approach in supporting the costs with Medicare.
So let me say there are many strains going here. COVID-19 has shown that our social safety net is frayed. And what we need to do is rethink that safety net. In addition, we don't have a way now of getting to universal coverage. We have an unemployment system which doesn't cover the whole economy. We put in some temporary fixes with the first stimulus, sets of stimulus bills, but we need to make a structural reform to really put in place these things. So we're proposing to nationalize Medicaid and take it away from the states. That gives them $220 billion a year, to nationalize unemployment and cover gig workers, self-employed workers, and others. And in return, states would step up and use that money for education, infrastructure redevelopment, which increases the productivity and economic activity in a state. That seems like a good exchange. It seems like something the Republicans can support, and it seems like something the Democrats can support for their different reasons, but coming together, that makes it both good policy and good politics.
And something that, as you noted, could potentially be achieved rather shortly here, too, as we feel the pressure now on both sides to move forward with at least another wave of stimulus. But Dr. Emanuel, always appreciate you having the time to chat with us. I also want to note, too, you're one of our most noted guests. We love having you on. So if you want more from Dr. Emanuel beyond the 10 minutes we were just able to spend with him, I should note his podcast, Making the Call, which talks about the challenges forced upon us by the coronavirus crisis, is very good. I would urge you to check that out, as well as his new book coming out, Which Country Has the World's Best Healthcare, out tomorrow, June 16th. Both of those things I must mention. But Dr. Emanuel, appreciate you taking the time to chat with us.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.